Hello, ladies. I hope everyone is doing well and staying safe. Today, me, Hannah, and Ashley are going to talk about abuse and neglect. Domestic violence is the abuse by one individual of another in an intimate or family relationship. The entire dental health team needs to be aware of the problem of family abuse and neglect and prepared to identify and report suspected cases to authorities. Those at risk for maltreatment are children, elderly, persons with disabilities, and women. However, special needs children are more at risk to be victims of abuse and neglect. Family abuse may be categorized as physical violence, emotional abuse, sexual abuse, neglect, or financial exploitation. Those patients may be seen in a dental office or clinic, whereas others may be taken to hospital emergency because of serious body injuries have been inflicted. Abuse can be detected during the initial assessment of patients, particularly the EOI examination. Examples of what can be seen in EOI examination are head and facial injuries, oral trauma, lesion and abdominal pathology can lead to be suspicion of abuse and neglect. Neglect is a deprivation of food, water, clothing, shelter, medical care, or education. Physical, non-accidental injury or threatening injury. Sexual, use of sexual act to hurt, degrade, dominate, humiliate, or gain power over. Emotional, intimidation with yelling, gestures, force against object, threatening or isolating the victim. Destroying self-esteem, excessive demands, and withhold love and affections from victims. Manifestations of physical abuse are repeated injuries, all in different healing stages, laceration to tongue, lip, gingiva, or frenum, fracture to teeth or jaw, and alveolus teeth. Oral manifestation of sexual abuse, like cauliflower-like growth on lip, palate, gingiva, or tongue, like condyloma acuminatum, lacerated chancre or mucous pouch like syphilis, pharyngitis, tonsillitis or gingivitis like gonorrhea, gingivostomatitis, herpes, oral warts, human papillomavirus, palate, petechia like forced oral sex.
Some signs of emotional abuse are aggression, disruptive behavior, anger, rage, unusual anxiety or fear. Signs of neglect include poor oral hygiene, untreated dental diseases such as rampant caries, oral pain or infection, bleeding or trauma, lack of continued care once informed, which kind of goes hand in hand with the untreated dental disease. We may explain to the patient the degree of the disease and they just don't care to take care of it. This could also include poor oral health literacy, financial or geographic restraints, lack of providers, and cultural differences. Some genetic conditions that are often confused with abuse is Sturge-Weber syndrome, which is the picture of the baby there. It looks like he's been punched in the face, but it's actually a birthmark. It usually appears on the face, and it's a genetic condition. Ehlers-Danlos syndrome is loose joints and hyperelastic skin. They bruise easily. You may have a patient that's covered in bruises and has loose joints, and you think that they could be a victim of abuse, but that's not always the case. And lastly, there's idiopathic thrombocytopenic purpura, or IPT. In a person that has this condition. They have few platelets in their blood, so it doesn't clot. It causes bleeding underneath the skin, and it appears like a petechial rash. They also bruise easily. They get frequent nosebleeds, and they bleed in the mouth. And women have heavy menstruation cycles. Other victims of abuse include domestic violence, which is when a partner in the relationship uses abusive behavior to sustain control and authority over their partner. We'll want to just ask routine questions and document the safety of the client. If you have a client that you suspect may be a victim of domestic violence, these are a couple questions that you can ask them that are not too accusing, and it may make them open up a little bit more. You want to keep in mind that every state's legislative policies are different for as far as reporting. So just make sure you know what your state policies are. Bullying is the use of force or threatening to abuse or intimidate others. Bullying remains in variation of environments and is an exceedingly frequent public health problem. It can include abuse in the form of verbal behavior, physical assault. It can be in person or electronic. Cyberbullying has become a huge problem more recently, and it may be habitual. You may have a child that's a victim of bullying, or they might be a bullier, and you may notice these things and they may be hiding it from their parents. So it's good to be aware. Human trafficking is a form of modern day slavery and exploitation of others to gain a profit. It is the fastest growing and second largest criminal industry in the world. Most victims suffer from malnutrition, dental decay, pain, mental health issues, physical violence, sexual abuse. They're usually unhygienic and often have infectious illnesses. Some indicators of trafficked victims, they're usually not alone. They're accompanied by somebody. They may be extremely shy or timid. They have another person that acts in charge of them. The trafficker will dictate their dental treatment, not giving them a say in anything. The victims often have no form of identification, may not even speak English, and they're usually taken to multiple offices instead of one.
Communication. So we want to take separate patient histories from patient and adult and see if they match. Ask about similar injuries with patient or other members of the household. We always want to use our best judgment if further conversations need to take place. Always separate individuals and speak to them privately. We never want to use judgmental or accusing language. Express that the patient health and safety is our first concern. If suspicion continues to arise, we can always consult with other healthcare professionals. And if we feel the patient is in danger, we can contact CPS or APS. Document, document, document. So we always want to document any text or photos of any lesions, keep out our personal opinions and only document the facts only. Include all of our findings, conversations, full names, and direct quotes. Document the reason for treatment or the lack of treatment. And we want to obtain consent for any photographs or radiographs that were taken. All right, educational and awareness program. The abbreviation is PANDA, and it stands for Prevent Abuse and Neglect Through Dental Awareness. This is a program that was created to promote an environment of understanding in dentistry and other professional communities to increase the prevention of abuse and neglect through early identification and appropriate intervention for victims. Research continues to show the need for abuse and neglect education among all dental healthcare professionals. Reporting abuse. Mandated reporters for child and vulnerable adult victims is defined as persons obligated by state statutes to disclose suspected abuse and neglect to the proper agency. This includes dental hygienists and dentists. So we want to report any suspicions to the appropriate authority and document there are observations in the client record. And then mandated reporters are protected by immunity laws. The appropriate authority to contact would be CPS if we suspect any child neglect or abuse, the Family Violence or Adult Protective Services if we suspect any domestic violence or elder abuse, and then we can always call 911 if we're unsure of which authority to contact. And then at the bottom here is a link for a complete listing of reporting hotlines. Legal and liability issues. So mandated reporters such as dental hygienists and dentists are obligated to report any suspected abuse. The consequences for failing to report any abuse or neglect can vary depending on the state you're in. So the fines can range between $100 to $5,000, and prison time can range from 10 days to 5 years. Failing to report any abuse or neglect can compromise the dental professional's license, and it can also compromise the safety of the victim, which can result in further harm or abuse and even death of the victim. We want to provide community-based domestic violence resources in the dental office, such as maybe pamphlets scattered around. And then if our client does open up to us about neglect or abuse, we want to communicate to them that help is available to escape an abusive relationship. So the questions for our presentation are: who is at more risk for abuse and neglect? What is the role of the dental hygienist? What are the types of abuse and neglect? What are some signs of abuse and neglect? And what documentation is needed? So this was our presentation on abuse and neglect. I hope you learned maybe how to identify if your client is showing any signs and symptoms of abuse and neglect, and that you now know the proper documentation you need and who you would contact. Okay, thanks for watching.